the one thing perhaps would be good for you to explain right now before we continue any further is what are stem cells and what do stem cells actually do in the body?
Oh, that's such a great question. So, it's funny. Everyone really always wants to look and feel, perform, and live younger, but stem cells really are the key to that. They're not only a vital part of our immune system, but they repair and they rejuvenate, they regenerate damaged cells. They are your body's raw materials. They are what made you when you were born. So they do things that we don't think about, like reduce inflammation and the trigger the death of old cells. But they self-replicate, but they can become and differentiate into multiple different tissues. So they can become bone or cartilage or fat or ligament. They can be brain or liver or kidney or lung or anything your body needs. And they know where when you're activating your own, they know where to go and what to do. So they go where it's needed the most. Well, when you're 30, half of your stem cells are dormant. And when you are 60, they are almost all dormant. So I'm 59 and almost all of my stem cells were dormant. They're not anymore. I think you're mid 50s, if I recall correctly. And
Yeah.
so your stem cells are not working for you. So they're in there floating around, just not active, kind of sleeping on the job. And so the fewer that we have that are active and working for us, the faster we age and the slower we heal. And so when we can get those activated, they go to work and they go wherever they're needed the most. And I would love to say, I need you all stem cells. I need you all to go hit my husband's Alzheimer's, right? That's where I need you. But they may go in there and say, hey, Darlene, your husband was a naval aviator for 30 years. We're starting with his liver. I don't know. They go where they want to go. And so one of the things I love is that we have supplementary products that can help direct. All right, I need to be activating the stem cells in the muscle, in the brain, in the heart, in those areas, and we can target those areas. So it's that's a little bit about stem cells.
Right. Yeah, you've answered that question very well. And can you describe what the technology is that you use and actually so that the viewers actually understand how it works?
Yeah, I will. I'll do my best. This is really kind of breakthrough technology. We have a brilliant scientist and researcher, sort of a genius inventor. He has over 150 patents focused on anti-aging and regenerative science, and actually we'll have 180 by the end of this year, as I understand it. Really, he's been leading the phototherapy industry for research and science for about 20 years, I think. Um, there are over 90 clinical studies proving the efficacy of this technology. And what I love about it, it's safe because it's light therapy, right? You had a guest talking about red light therapy. You can't overdose on light. There are no contraindications, no drug interactions. It is inexpensive. There's no prescription required. And it's available in 87 countries. So it's not a new thing. The company's been around 20 years. It's a non-transdermal patch. It looks like this. It's the size of a quarter. It has organic materials and nanocrystals. And when applied on the body or near, even in my pocket, even near the body, it activates, it's activated by body heat and light. And what it's doing is not unlike, you've talked a lot about vitamin D on your podcast. When you go out in the sun, your body makes vitamin D. Well, that's photobiomodulation. That's light therapy. And similarly, it makes melanin with a different light wave, right? So you have light inside of you, Lee. If I were to look at you with night vision goggles, you see light and heat inside
Mm.
of you. And so what this is doing is it's reflecting your own light back like a little mirror at very specific wavelengths to stimulate targeted beneficial biochemical responses. And nothing is entering the body, nothing except that light being reflected. So it's being used by elite practitioners, only the open-minded ones. So a lot of holistic, integrative, and functional medicine doctors. But we actually have a world-renowned plastic surgeon. He's actually been featured on the Doctor's Show and the Dr. Oz Show, Dr. Adam Shiner, and he has his patients use the stem cell activation patch 3 months prior and 6 months after surgery for healing, and it's healing the skin and the wounds from the plastic surgery. He does face stuff. It's healing it at least 40% faster. There are cardiologists that are experiencing amazing things. There's a Dr. John Harmon who's written this book called How to Reverse Aging, a comprehensive guide to copper peptides. And he had a right branch bundle blockage. Nothing you can do about that. No medicine, no surgery. And in 14 months on the stem cell activation and the anti-inflammation patches, it went away. It was no longer there. His cardiologist couldn't believe it. We have anesthesiologists or, chiropractors, psychiatrists, osteopaths, dentists, you kind of name it. And there's one anesthesiologist, I love what he says, and I think you appreciate this quote: your health is your greatest wealth. And his name is Dr. Joseph Peck. He's an anesthesiologist, 40-year physician. And he says that this is the most significant medical breakthrough in my lifetime and one of the most amazing products in medicine. And I know you do a lot with very elite athletes and helping them with pain management and other, even just performance. And I'll tell you that in the 2008 Olympics, we had over 300 Olympic athletes wearing our patches. And you can look at pictures of them: Serena Williams, David Beckham, Michael Phelps, for the enhanced performance and the rapid recovery. And more recently, I learned that Ivory Sully was talking in a podcast in September that Tom Brady is wearing these patches. And then recently we learned that the Kansas City Chiefs that just won the Super Bowl here are wearing the patches. So many have called this the holy grail of anti-aging and restorative science. And the way it's working, it's not just that it's reflecting light. What it does when it reflects that light is it's